Okay, Mr. Partlow, so now we're going to move on to something that's called our Ryan test. I'm going to hit the fork again, and I'm going to put the tuning fork behind your ear and let me know when you can no longer hear the vibration. When you can no longer hear it, I'm going to put it in front of your ears, and you let me know the same thing, okay?
Yes, ma'am. Okay, I don't hear them.
Okay.
Okay, I don't hear it.
Okay, we're going to do the same thing for the other ear.
Okay. Okay.
Okay, good. So it seems like you can hear both of your ears. Now we're gonna move on to your nose. Just inspect your nose. Like I said, it looks symmetric. I don't notice any deviations or anything. Notice when I'm inspecting your nose. I'll just palpate your nose for any tenderness. Let me know if you have any pain or anything like that.
Okay.
I don't feel any lumps or any bumps on that part. Now I'm just have you put your head up to the, kind of tilt your neck up to the ceiling. I'm just looking to your nose for any swelling, looking at your septum and all the above. Nose looks nice and pink. Both your nares. No trauma or anything noted on that part. Now I'm gonna inspect your mouth and your throat area. I'm just inspecting your lips. Looking nice, moist, pink color. I don't notice any sores or any cracks noticed on there. I'll just have you open up your mouth and I want you to say ah for me. Just looking in your mouth, your tonsils look good, nice and pink. Looks like you have all your teeth, a few cavities noted. I don't notice any inflammation or anything noted in there. Now I'm just feeling inside your mouth. Let me know if you have any tenderness or anything noted in there. Any tenderness? Your mucosa look pretty good. I'm just having you look up your tongue for me, and I'm just looking underneath your tongue at your ducts. Everything looks symmetric there. I don't know if it's any ulcers or anything like that. And you do have a positive gag, correct?
Yes.
Okay. Now we're gonna move on to your respiratory and your cardiovascular. So what you just sitting up here, your respiratory rate and everything looks good. Doesn't look like you have increased work of breathing or anything like that. You're not using your accessory muscles or anything like that on that part. Now I would just have you face your back towards me. I'm just go for your firmness. Make sure you have good vibration and it's symmetric. So I'm gonna start at the bottom and of your back, and I want you to say 99 for me. Okay.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, so everything feels symmetric and pretty good on that part. Now I'm just look for your thoracic extrusion. I'm just put my hands on your back and on your middle of your back, and I just want you to take a deep breath for me. I'm push in, take a deep breath, and exhale. Okay, everything looks good. I don't just calculate for any crepitus or anything like that. I don't feel any crepitus or anything like that. Now I'm just measure your diaphragmatic extrusion. So now I want you to take a deep breath and I want you to hold it for me. Okay. Now I want you to take a deep breath out and I want you to hold it for me. Just gonna measure that. You got about 4 centimeters, which is within normal range. Now I just listen to you. I'm gonna listen for any vibrations and make sure that your chest walls and lung walls are pretty symmetric. So I want you to do the same thing for me. I want you to say 99 again.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, Mr. Parker, so everything sounds pretty symmetric on that part. Now I'm gonna just percuss your back area for your lung fields. And now I'm gonna just listen to your lung sounds, make sure I don't hear any crackles or anything sounds abnormal, any wheeze or anything like that.
Okay.
I'm gonna start with your back, and then I'm gonna move to your front.
Okay.
Take a deep breath in for me. Again. Okay. Last time. Okay, so you sound pretty clear and equal. Now I'm gonna have you turn to the forward. I'm gonna turn to the front. I'm gonna percuss the front part and listen to your lung sounds that way as well. Okay. I'm gonna start with percussion. So I don't feel any dullness or anything noted in that part. Now I'm just listening to the front part of your lungs, and I want you to take a deep breath again for me. Okay, Mr. Partlow, you sound nice and clear. Now I'm gonna just have you lay back for me. Just lay on your back. Okay, I'm just inspecting for any heaves or lifts or anything like that. Can you put your arm down? I don't notice anything like that. I'm just standing to your side and looking at your aorta. I don't notice any pulsations or anything like that. Everything looks good on there. Now I'm just moving. I'm gonna just palpate your landmarks. So we're gonna start with your right sternum border around here, your second intercostal space. Move to your left sternal border, and then your apex. So everything looks good. I'm just palpating again your landmarks or any thrills or anything like that. I don't feel anything, the palm of my hands. Now just move to your apical impulses over here, your left side on your back. I don't feel anything there. And I'm just having you lay on your left side so I can just palpate it that way too.
Lay on my left?
Yes. Palpate right there. Okay, everything feels good. Okay, you can turn back to your back, Mr. Hartwell. Now I'm just going to grab my diaphragm and I'm just listening to your heart sounds. So I'm going to start with your aortic on the right. And then I'm going to listen to your harmonic. I'm going to move down to the Erb's point on your left side. And then your tricuspids at the fourth space. And then move down to your mitral. Everything, I don't hear any bruise or anything like that. And I'm gonna just go back up, listen for any murmurs. Start with the same landmarks. Back up to your aortic on the right side, move over to the harmonic, go down to your Erb's points, your tricuspids, and your mitral. Now, Mr. Partlow, I'm gonna just have you hold your breath for me a little bit. I'm gonna just make sure I don't hear any bruise or anything like that. Okay, so everything sounds good. Now I'm just have you sit up and I'm gonna listen to those same landmarks for me. I'm just listening with the bell of my diaphragm, make sure I don't hear any murmurs. Your aortic, your right sternum, move over to your harmonic, move down to your Erb's point, your tricuspids, and then your mitral. So everything sounds good. I don't hear any murmurs or anything like that. I don't hear any splitting between S1 and S2. You can lay back down for me, please. Now I'm gonna move down to inspecting your abdomen. And then I'm just put this pillow underneath you, Mr. Partlow. Thank you. I'm just look at your abdomen. Can I just look up your shirt a little bit? I don't notice any scars or anything like that. A few stretch marks, but your color and everything looks pretty good. Skin looks good. Looks like you have pretty good venous return there. As you were laying down, I did examine your abdominal muscles. I didn't really notice any hernias or any splitting with your muscles or anything like that. So that looks good. Now we can just take the pillow up underneath you. Lay back down. Now I'm gonna just listen to all 4 of your quads, making sure I can hear pretty active bowel sounds. So I'm gonna start with your lower right, to your upper right, upper left, and then lower left. So you hear pretty active bowel sounds. I'm also gonna listen to your arteries, your iliac and your femoral and your renal arteries. And I'm gonna listen for any bruits there. So I'm gonna just have you kind of hold your breath for me while I'm listening for those, okay? So we're gonna start with your iliac to the right side. Hold your breath. Over to your renal. Okay, you can take a little break. Okay, hold your breath for me again. We're gonna move down to your femorals. Okay, so there's no bruits or anything that I heard, which is a good thing. Now I'm just gonna palpate your abdomen. We're gonna start with a light palpation. Just start and let me know if you have any tenderness or anything like that.
No pain.
No tenderness or pain. Okay, now we're gonna do something with a deep palpation. Same thing. I'm gonna just feel for any masses or anything like that. Let me know.
No pain.
So I don't feel any masses or anything like that. Next, I'm gonna just look at your umbilicus and your ring, your umbilicus ring. I don't notice any. Let me just. Everything looks pretty centered. Just palpate that. I don't feel any bulges or anything like that. It's nice and soft. Looks like you have an inverted belly button. It's pretty centered. So everything looks good there. Now I'm just palpate your liver for any enlargements or anything like that. Then I'll just go down to your gallbladder. That shouldn't be able to palpate, and I'm not able to palpate your gallbladder, which is good. Now I'm gonna palpate your spleen area, and when I palpate this, I want you to take a deep breath for me when I reach in with my other hand, okay? So I'm gonna push and take a deep breath. Okay, breathe out. Okay. Now I'm gonna just measure your I'm gonna just palpate your left and right kidney, and then when I do this, I want you to just take a deep breath for me.
Okay.
So just reach across, just palpate, take a deep breath. Okay. Just do it with this one. Deep breath. Okay. Now I'm just gonna palpate for any aortic pulsations. I don't feel anything over that. And then when I was palpating your abdomen, I don't feel any other masses or anything on that particular part. Now I'm just gonna do something, a percussion, make sure I don't feel any dullness or any gastric air bubbles, okay?
Okay.
Now I'm gonna do something, I'm gonna measure your liver span. That's just with the dullness of your liver. So I'm just gonna push in right here. Take a deep breath. Okay. Okay. right here. Put your finger right there for me. Thank you. Right here. So I got about 8 centimeters, which is pretty normal. Now I'm gonna have you sit up for me, Mr. Partlow, and I'm gonna stand behind you, and I just want to feel for your kidneys, make sure you don't have any tenderness or anything like that.
Okay.
So I'm just kind of make a fist over each kidney at the 12th rib for your CVA. Let me know if you have any pain or anything. Okay?
Yes.
Okay, ready?
No pain. No pain.
Okay, perfect. Now you just face forward for me. Now I'm gonna move down to examining your arteries and your veins. Just looking at you, can you hold your arms out for me? Color looks good. Like I said before, your nail beds looks pretty good, nice profuse, nice pink color. Your hair is well proportioned, no edema or anything noted on that part. Now I'm having you lay down for me another time, please, Mr. Partlow. I'm just gonna assess your JVP. First, I'm gonna have you lay down flat, and then I want you at a 45-degree angle so we can start laying down flat.
Okay.
And when you lay down flat, I want you to turn your head to the left side for me.
To the left.
Yes. Okay, so I see your veins. Now just palpate for any pulsations. I don't feel any pulsations. Now I'm just gonna put this pillow underneath you, try to get you at a 45-degree angle. I want you to keep your head at the face to the left for me. Okay, let's see your jugular vein. Just palpate again for any pulsations. And I do not feel any, so that's a good thing. Now you can sit up for me again, Mr. Partlow. Just gonna palpate your arms, your upper extremities, warmth, any tenderness or anything like that.
No.
I don't notice any edema or anything like that. I'm gonna palpate your radial pulse over to your brachial. Just on radial over to your brachial. Your pulses are nice and strong. I would say about +2, +3. Now I'm just palpate and just look at your lower extremities. So I'm having you lay down again for me. Feel your lower extremities. Feels nice and warm. Any tenderness or pain?
No pain.
So I'm gonna do your popliteal pulse. So I'm just cuff my fingers around the back of your knee, and I want you to flex your knee for me. Okay. Just looking at rate and contour and everything feels good. Move down to your duralis pedis pulse. Then your posterior tibialis, so the inner part of your feet. I did listen for your other breweries. I'm just gonna listen like at your carotid artery. So I'm just gonna have you. I'm listening with the bell in my stethoscope again. I'm just gonna have you hold your breath for me. Okay. And a deep breath. Okay. It sounds good. I don't hear any breeze. Now I'm gonna have you sit up for me again, Mr. Partlow. Now we're gonna be moving on to your neural exam, assessing your cranial nerves. Okay.
Yes.
So the first thing I'm gonna do is cranial nerve number 1, olfactory. Tell me, what do you think this smells?
Deodorant.
Okay, perfect. Now we're gonna do cranial nerve 2, your optic. So I want you to cover. We'll start with your left eye. Cover your left eye and tell me how many fingers I have up.
2.
Okay, we'll do the other eye.
5.
Okay, perfect. Now I'm gonna look at cranial nerve 3, 4, and 6. I'm just making sure you don't have double vision. Make sure your pupils are nice and reactive. I want you to follow my finger and tell me how many fingers I have up.
2. 3.
Okay, we're gonna come over this side, do the same thing.
5. 4.
Okay, perfect. Now I'm gonna just put this pin light in your eye, shine it once again. And I just want you to look straight ahead into the pin light. I'm just checking for your eye reflexes. Eye reflexes are nice and reactive. Now we're gonna do a accommodation reflex. Once you follow my finger until and I'm gonna bring my finger into your nose. Perfect. Now we're gonna do something. I'm gonna just test your sensation. I'm gonna have you close your eyes and I'm gonna rub this tissue on your face and let me know when you feel it. Okay?
I feel it. I feel it. I feel it. I feel it.
Okay, perfect. Now we're gonna do something with your I'm gonna test your pain. I'm gonna have this pin on your face and let me know when you feel like the little prick or the pain, okay?
I feel it. Feel it. Feel it. Feel it.
Okay, perfect. Now we're gonna move down to your cranial nerve number 7. I want you to wrinkle your forehead for me. Frown. Close your eyes real tight. Open your eyes and just make a face. That's good enough. Smile for me. And do a kissing, like you're kissing. Okay, perfect. Now we're gonna check your Selma. I just want you to bring your neck kind of in, make sure it's nice and symmetric. Okay, perfect. Now I'm gonna just do the tuning fork. Just check your vibration, just to make sure that you can hear. Hear that?
Yes.
You hear that?
Yes.
Okay, perfect. I want you to open up your mouth and say "ah" for cranial nerve number 9. Okay, nice. And we did address that you do have a gag reflex, correct?
Correct.
Okay, now we're going to move down to cranial nerve number 11. I want you to shrug your shoulders and don't let me push down. Okay, so your strength is pretty nice and symmetric. And then cranial nerve number 12, I want you to stick out your tongue and move it side to side. Okay, perfect. Now we're going to do your proximal and your distance examination. I want you to put your arms out in front of you and don't let me push down. Okay, perfect. No pain or anything. Okay, now I want you to do your elbows the same way and try not to, by your wrist, try not to let me push down.
No pain.
Okay, perfect. And then, now I'm going to check your, you put your arms down. I'm going to check your knee strength. Have your knees out, each knee, try not to let me push down.
No pain.
No pain.
No pain.
Okay, nice. Now I'm gonna do a test tone examination. I just want to move your grab arm. I'm just moving in a circular motion. Okay, everything's pretty symmetric there. For your lower extremity, I'm gonna grab your leg and I just want you to relax your leg and I'm just drop it. Okay?
Okay.
Okay. Perfect. And can you just hold out your arms for me? I just want to make sure you don't have any abnormal movement or anything like that. Perfect. Now we're going to move down to the fine motor skill. I want you to kind of do like a patty cake with your hand back and forth for each hand for me. Okay, perfect. Your other hand. Okay, now I want you to take your heel of your foot and just kind of stroke it down each of your legs. Okay, now we're going to do your gait examination. So I just want you to stand up and just walk to the door for me normally. You can come back. Okay, walk on your tippy toes. Okay, and then go back and walk on your heels. Okay, and then stop halfway. Well, you could come back and stop. Come back. And then put your feet together and look straight ahead and close your eyes. And that's the Romberg test. Okay, now we're going to do it's the Tatum test. Open your eyes and walk with one foot in front of the other. Okay, perfect. Come and sit down for me, Mr. Partlow. Okay, now I'm going to just take the pen that I had before, and I'm going to prick your hands and feet and ask me, does it feel any different? Any difference or anything like that? Going up to your shoulders?
No.
Okay, I'll do your other one. Put your Okay, let me just do your foot down, jump over.
No.
Yeah, do the other one.
No.
Okay. So I want you to flip your hand over for me if I could look at your palm. I'm gonna just compare your index to your pinky finger. Let me know if the sensation is different. Your pinky and your index.
No.
Okay. Pinky and index.
No.
Okay, and then we're gonna do the same thing with your lower extremity. Do your second toe and your pinky.
No.
Second toe, pinky.
No.
Okay, so I'm gonna have you close your eyes and I'll put something in your hand and you let me know what it is. Open your hand. Okay.
Okay.
Okay, perfect. Now I'm gonna just touch a few of your body parts and you let me know what I'm touching. Okay?
Are my eyes open or closed?
Your eyes closed.
My shoulder. My ear. My eye. My knee. My wrist.
Okay,
My hand.
perfect. Now we're gonna do a 2-point discrimination test. I want let me know if I'm poking you once or twice. Okay?
Eyes open or closed?
Closed.
1, 2, 1, 1.
Okay, perfect. And then now we're gonna do it open with your eyes open.
2, 1, 1, 2.
Okay, perfect. Now I'm gonna have you hold out your palm of your hand and I'm gonna draw something in your hand. Let me know if it's a letter or if it's a number. Close your eyes for me.
Letter.
Okay.
A number.
Okay, perfect. Now we're gonna move down and assess your reflexes. I'm gonna do your biceps. Okay. Okay, now we're gonna do your brachioradius. And then we're gonna do your tricep. And then we're gonna move down to your ankles and have you flex. Well, I'm gonna do your knees first. And then I'm gonna do your ankles. Touch your knee for me. And then I'll do your Achilles, back of your foot. Okay, everything looks good. I'll give your reflexes about +2 reflex, and I'm gonna do your ankle clonus. So I'm gonna have you lay back for me, Mr. Partlow. So I'm gonna have you flex your knee, and I'll move your knee in a circular motion, kind of bend it back. I'm gonna move your ankle in a circular motion, kind of cop it back. Okay. Okay, perfect. Reflexes are pretty good there. You can sit back up, Mr. Partlow. Then lastly, we're gonna move on to your musculoskeletal. Just inspecting your finger. Hold your arms out for me, please. Just inspecting your fingers and wrists. Everything looks evenly distributed. Looks nice. I don't notice any masses or any swelling or anything like that. Do you care if I palpate your fingers for any lumps or anything like that? Sometimes that lumps could be sign of rheumatoid arthritis, and I don't feel anything there. Just gonna palpate your radial heads for any warmth or any swelling. Any pain or anything?
No pain.
Okay. So next we're gonna, I guess I'm just hold out your arms and so your arms are nice and symmetric and nice and aligned. Your skin tissue looks pretty good. Nice pink color, looks well perfused. Now we're gonna move to your range of motions. So we're gonna just start with your hand range of motion. Just do extension.
My fingers.
Yeah, you do your fingers. Extension. Then flexion now. And then we're gonna do abduction away from the body with your fingers. And abduction towards the body. And then we're gonna move to your wrist. We're gonna do extension, wrist up. and then flexion, wrist down, abduction away, abduction towards your body. And then we're gonna move down to your elbows. Look at your elbows.